All right, well, welcome everyone. Thanks for coming. Everyone's doing well. Does everyone live in Englewood? Yeah, some? Other people near here? Nice. Well, I guess we'll get started. We might have people walk in a little late. My name is Cara Minichetti, and I'm a dentist that practices here in Englewood. I'm also on staff at Englewood Hospital, so I'm affiliated. I lived in Englewood for a little over 2 years, like just across the street from here. I just moved to Teaneck, but Englewood is my community. I treat patients from Englewood every day, so I'm happy to be here speaking with you guys a little bit about oral health and how important it is, some common concerns with our oral health, and additionally how it's related to our overall health. Because of course the mouth is a part of the body, so they're intricately related. A toothache may seem like just a little toothache, but it can have overall effects on your body health. So I want to talk about all of that. A little bit about my background. I grew up in New Jersey in Bergen County my whole life. I went away to Washington, D.C. for undergrad for a few years, but I came right back. I did my dental training at Columbia, just a stone's throw away across the bridge. And after that, I did some residency training in Newark, at Newark Beth Israel, and a little extra CE training as well. I practice here in Englewood on Grand Avenue. I have 3 main partners with me, and we provide all kinds of dental care, restorative, emergency, a lot of implant dentistry to replace teeth for patients who are missing teeth, which is a hugely helpful service because we need our teeth to chew, to smile, to talk, to feel confident. So it's a great place, and we'd love to have you by at any time. And like I said, I'm also affiliated with Englewood Hospital. I do some dental cases in the operating room there every once in a while for patients, pediatric patients, adult patients who might have special needs, whether that be medical or developmental. So we do some dental work there. And additionally, we have a residency program. So we have dental residents that are on call at Englewood Hospital 24 hours a day. 3 to 4 residents per year. And they also have an outpatient clinic right on South Van Brunt Street where they provide regular dental work 5 days a week through the North Hudson Community Action Program. So I'm there once a week with them, guiding them through clinical treatment, and we'd love to have you there. They are very helpful for our community because they can provide affordable dental treatment as well, according to patients' abilities. So that's a great program, and that's enough plugs for all my stuff. So we'll get into the real topic of oral health. So what are we looking for when we talk about oral health and wanting to achieve oral health? I separated this out a little bit, but we want to see absence of pain, absence of infection, a healthy, stable bite, healthy, stable gums, the lack of puffy, bleeding gums, the lack of bone loss around the teeth, and additionally no pain in the jaws. A lot of times some people will experience TMJ pain or clicking and popping. We'd like for our teeth and their bite to support the jaws and protect each other with the bite. So we'll get a little bit into each of these things, starting with the teeth. What we're most worried about with teeth is cavities and decay. The way that cavities come about, we all know about them, is because of the bacteria that live in our mouth. So we have a microbiome in every part of our body, and our gut microbiome is like a trendy topic nowadays, trying to support a healthy gut microbiome, but we also have an oral microbiome. So we have bacteria that live in our mouth. Some of them are helpful for us, some of them can be more harmful, and the varying amounts of each bacteria will change over time. And it has to do with our habits, such as our diet, and also our cleaning habits, both at home and at the dentist's office. So when we have an excess of bad bacteria, or we have a diet that's high in carbohydrates or sugars, we get a breakdown of those carbohydrates by the bacteria. They essentially like to eat those sugars off our teeth, and in that process, they release acids. Because our teeth structures are made up of minerals, just like our bones, these high acidic environments can break down the tooth structures. So as this happens over time. We'll get an incremental decrease in the strength of the enamel on the most outer surface, moving into the dentin. And once we get to that inner layer of each tooth, we've reached the pulp or the nerve of the tooth. And this is where we have our nerves and blood supply, and also a pathway to the bottom of the root of the tooth. So this is where we can get pain, infection, and when we need to start getting into root canals, we might have a toothache. So we like to prevent these or clean these up when they are in their early phase. So detecting them early, really cleaning our teeth very well, decreasing the amount of carbohydrates in our diet, and following up our carbohydrates with water or brushing 30 minutes after candy. We don't want to limit it completely, but being mindful. As I said, once we get that bacteria into the third layer of the tooth, into the nerve of the tooth, this can become a pathway for that bacteria to really enter into the nerve and the bloodstream. This is when we might get a large hole in our tooth that we might notice, food trapping. This also weakens the structural integrity of the tooth. So you might see a big chip or a big fracture of the tooth that might lead to a bigger issue. And this is also when we might get pain or infection, swelling, abscesses, etc. Some signs that we might have an infection in our tooth are pain. This might be exacerbated by hot or cold temperatures when we're eating ice cream or having hot coffee, or it might be out of the blue spontaneous pain. We might see bumps or pimples on the gums, or even get some swelling of the gums or face. And sometimes swelling of the face from a tooth can really be a serious medical issue, particularly if we're noticing that we're having a difficulty swallowing or breathing. This is a true medical issue, and we want to have you be seen in the ER immediately by one of our dental residents, because this can be a serious issue. Moving on to the gums. Any questions about the first section? No. Okay, hopefully it's interesting. Moving on to the gums, same thing. We've got a microbiome, and certain bacteria will affect the gums more than the teeth. So all the time, we've got this microbiome and bacteria that are living on our teeth and in the pocket of between our gums and our teeth. And our body fights off these bacteria in a maintenance way, the same way that you might get a cut on your arm, and of course it's exposed to bacteria through the day, but you don't get a massive infection or sepsis because our immune system just fights it off, and it does this maintenance cycle. However, when this is over time, an excessive burden on the immune system, maybe because there's excessive amounts of bad bacteria, there's a lot of tartar, a lot of plaque, and it's just too much. Or you might be genetically predisposed to an overreaction by the immune system to this bacteria. You can get some damage to the gums and the bone around the teeth. And this is because it's a battlefield within that pocket between the gums and the tooth, fighting off the bacteria. And there's some bystander damage. There's inflammation, so the gums might become irritated. And over time, we might even lose bone support because of this bystander damage to the area. Overall, when we've got gum disease and a lot of this fighting within our mouth for a long time, it leads to chronic inflammation. It's like we have a cut on our arm that we're fighting off for months and years. So this does have an effect on the overall state of the immune system throughout the body, and this can have an effect on other infections or medical conditions that we're dealing with elsewhere. There's a progression of gum disease, just like we talked about with cavities, going from the outside in. This goes from mild to moderate. So starting with gingivitis, I'm sure you guys have heard about this, like at least on a toothpaste commercial, people talk about gingivitis. And this is just that early inflammation of gum tissues. We haven't gotten any damage to the bone just yet, but we might see puffy gums, bleeding gums, or your dentist might notice that you've got bigger pockets between the gums and the teeth because the gums have gotten puffy and inflamed. And this is a sign that there is too much inflammation in the mouth that can be resolved from better cleaning, different toothpaste, various interventions, and this is reversible. You can cure gingivitis through some pretty non-invasive treatments like just better cleaning or more frequent cleanings at your dentist. However, if this progresses to true gum disease, which we call periodontitis, this is when we've got a little bit of bone loss. So this usually cannot be reversed. We've now gotten into the phase where the bystander damage in our mouth is so great that we've lost hard tissue. And the focus with that is really just maintaining where it is, stopping it from going any further. So we do deeper cleanings. You may have heard about deep cleanings at the dentist, as well as those other interventions like more frequent cleanings, better cleaning at home, changing your toothpaste. And this can range from mild to severe. And as it becomes very severe, we lose a lot of bone foundational support from our tooth roots, which is what keeps them so stable. So you'll see some loose teeth with very severe gum disease. And you can see with this patient, they've got a lot of buildup of plaque and tartar. So this might be a little bit of combination of extra bad bacteria in this patient's mouth, plus maybe a little bit of, he could have better cleaning at home, more frequent dental visits. So these teeth had to be removed because they had lost so much support that it was not able to be reversed. But he's doing well. We got him a lot of implants and he's got a great smile now. So there's something that we can't treat. But some factors that contribute to gum disease are that plaque and tartar. Plaque and tartar is a buildup of bacteria on our teeth. That white, smushy plaque is a biofilm. So it's a network of bacteria that create almost like a spider web, an oral environment. That sounds so scary. It's the first time I've used that analogy. I don't know if I'll use it again. That create a community and an environment on our teeth in order for them to better stick to our teeth, enjoy all those yummy carbohydrates in our mouth. And over time, they will calcify and get into that hard structure, which is the tartar, which is hard to remove at home. Plaque we can remove with our toothbrush, but tartar, really, we kind of need to get into the special instruments that we have at the office. So that's a buildup of plaque and tartar is one factor. And poor oral hygiene at home and poor infrequent dental treatments goes along with that. Additionally, smoking is a big risk factor for gum disease. The reason being the heat in the smoke and as well as nicotine shrinks our blood vessels in the gum. So it limits our ability to have those immune cells go to the source of bacteria to fight them off. So we get an increased risk of damage from that bacteria, an increased risk of bacteria in that area. Diabetes is a similar risk factor for the same reason. We get a little bit of a reduced immune function with advanced diabetes. So diabetes and periodontitis go hand in hand. Worse periodontitis can make diabetes worse and vice versa, and we'll talk a little bit more about that in a few slides. And additionally, genetic predisposition has a role. So, you know, a lot of times patients with bad periodontitis will say, my mother had the same thing. She had to have all her teeth removed. There is a bit of a genetic component. Some patients just have a microbiome that is skewed more toward that bad bacteria side. And they'll also have a bit of a bigger overreaction to the body's natural immune fight against normal bacteria, where they'll get this bystander damage a little bit more easily and see some bone loss. So some signs at home that gum disease might be present is that bleeding gums when we're brushing. We might see bad breath. That might be a sign of deep pockets around the teeth where bacteria are hiding, or high levels of tartar. Puffy gums, very red gums, loose teeth, of course, and your dentist might notice some increased pocket depths. Moving into our bite, or we call it occlusion. The bite is very helpful for protecting the jaws and the teeth. The back teeth are able to withstand a lot of force. We can actually put about 250 pounds of force on our back teeth when we bite down. They're very strong teeth and they've got multiple roots. And these back teeth support the front teeth, which can't really hold as much weight. These are thin, conical roots, single-rooted teeth in the front. So a healthy bite should have the back teeth touching when we are biting down to support those front teeth and take some of the load off. Additionally, the front teeth help the back teeth because when we move our jaws forward, say we're going to bite into an apple, we stop touching on our back teeth, and our body gets a signal, the brain gets a signal to not bite down so hard because it knows that the front teeth really can't handle that 250 pounds of weight, so it protects the back teeth. So over time, when years happen, habits happen, like grinding or clenching, or maybe breakdown of teeth or loss of teeth over years, this system can degrade, and you lose that protection that the teeth are supposed to provide for one another, and this may make things worse. For example, losing some back teeth because of toothaches or decay may lead to excess force on the front teeth, which can cause increased loss of bone around the front teeth and lead to loosening teeth in the front. So maintaining the entire system is very helpful for the other teeth. The loss of some teeth, is not just an isolated situation. It's a whole system that we want to keep nice and healthy. Additionally, we can see movement of other teeth when we lose teeth. Our teeth are constantly shifting all throughout our life, not just when we're kids with braces. Tooth grinding I talked a little bit about, but sometimes tooth grinding can be really so severe that teeth get extremely worn down, and this can lead to death of the nerve in the tooth because of too much wear, or additionally it can lead to a collapse of the bite. Everything gets shorter and the jaws will move closer and closer together until we get less spatial support and we get less support of the muscles in the jaw. Ideally, our jaws, we don't want to experience pain in the muscles that help us to open and close our mouth. We don't want to see clicking and popping. That can be indicative of arthritis in the joint of the jaw or hyperactivity of those muscles, which can be a side effect of excessive clenching or grinding at night. And sometimes your dentist might want to make you an appliance to wear at night or during the day to relax the system and protect those teeth from becoming so worn. So a little bit more about the connection between the oral health and our overall general health. So like I said, the mouth is, of course, a part of the body. Dental infections themselves can be serious. We talked a little bit about swelling of the mouth causing an issue with the airway. If you're not able to breathe because of swelling of the floor of the mouth, that can be a really serious situation. But additionally, dental infections can be risky for the overall body. If some of that bacteria from your mouth gets into the bloodstream, there's a risk of sepsis, or we can even breathe in some bad bacteria, and susceptible populations can get pneumonia from that. But additionally, some oral conditions can worsen systemic conditions. So let's talk a little bit more specifically. Starting with some medications. Some medications can have an effect on your oral health. Immunosuppressive drugs that decrease your immune system, these are used sometimes for cancer or for immune issues, such as rheumatoid arthritis or lupus. These will decrease our overall immune system's ability to fight infections. So this can make us less able to fight oral infections like cavities, tooth infections, and gum disease. Additionally, some medications will cause dry mouth, which allows that bad bacteria in the oral environment to flourish a little bit more. Our saliva contains enzymes that fight off bad bacteria and irrigates the mouth. It decreases the acids on the teeth. When we have dry mouth from medications, this can lead to a bad situation. Additionally, amlodipine, which is a high blood pressure medication, can cause puffiness of the gums. So that if that happens, we sometimes like to change that medication to a different high blood pressure medication. And additionally, some conditions that cause increased acid levels in the mouth can have an effect on our teeth, causing erosion of those minerals. So that includes acid reflux, high acidic diets, and eating disorders like bulimia. So getting into that diabetes topic, we talked a little bit about it. Severe diabetes decreases our immune system's ability to fight infection. So this applies to the infections that might be in our mouth, including low-grade chronic infections like gum disease. Additionally, diabetes leads to a higher risk of, diabetes leads to a higher risk of gum disease. However, also worse gum disease, it's been shown, also leads to worse diabetes in patients that have diabetes. It can be harder to control sugar when the gum disease is worse. So taking care of our mouth is very helpful for the overall body. Additionally, cardiovascular disease, high levels of bacteria in the mouth can lead to increased plaque buildup within our arteries. Some studies have shown. So that plaque buildup within our arteries closes off the free space within our arteries, which leads to a higher risk of high blood pressure. It's like a tighter hose, so the blood pressure increases with the less space that the blood has to flow through. And additionally, it can increase your risk of heart attack if that vessel becomes completely occluded, or stroke if some of that blood clot gets broken off and heads somewhere else. So again, it's another way. Kidney disease is similar to diabetes in that the two things have a correlation: gum disease and kidney disease. Worse kidney disease can lead to worse gum disease and vice versa. And the kidney is a very important organ for immune function, so we can kind of understand why that would be the case. And there's some studies that show that gum disease is correlated with a higher risk of Alzheimer's and other types of dementia. Rheumatoid arthritis, similarly, periodontal disease is associated with worse severity of rheumatoid arthritis, and additionally some of the medications that are sometimes used for rheumatoid arthritis can increase our risk for periodontal disease. We talked a little bit about this, the respiratory disease. Bacteria in our mouth, a buildup of bad bacteria can enter the bloodstream, or it can also enter the respiratory environment through our breathing that we do through our mouth. So some vulnerable populations like advanced age, or if their immunity is suppressed either through a medical condition or medications that are being used to treat a medical condition, it's possible to get pneumonia from this. And additionally, an interesting study between pregnancy and gum disease. Periodontitis among pregnant women causes an increased risk of preterm birth and low birth weight in pregnant women. A lot of times pregnant women, they want to stay away from the dentist during pregnancy. They have enough to worry about, but dental cleanings are totally safe to do during pregnancy, as are some other dental work, and the dentist can determine what is safe at which time in the pregnancy. But keeping our gums clean during pregnancy is very helpful, because pregnant people are also a little bit more at risk to some hormonal changes in the gums. They might see more gingivitis during this time, so a great time to keep the mouth very clean. And some studies also show a link between gum disease and colorectal and oral cancer. So a lot of reasons to keep our mouth nice and healthy. I want to talk about some ways that we can do that, some habits. So of course, we all know about brushing. We should brush 2 times a day for 2 minutes each. The method for brushing looks a little bit like this cartoon, angling that toothbrush so that the bristles are faced toward the gums and so that they almost peek in between that pocket between the gums and the tooth, trying to get that bacteria that's hiding in there, plaque underneath the pockets, and flush it out. Fluoride toothpaste helps to prevent and arrest cavities, that demineralization. Fluoride is a mineral that can insert itself into the structure of enamel to rebuild it and fortify it. It's stronger than enamel is without fluoride. Circular motions help, and brushing all the surfaces of the teeth, so that includes the biting surfaces, the cheek surfaces, and the surfaces by the tongue. And using gentle pressure, we can actually cause damage by brushing too hard. So we don't want to see our toothbrush bristles flattened out at the end of that 2 months, not putting too much force on the gums, because we can cause trauma and recession to the gums if we brush too hard. So nice gentle pressure. Flossing is hugely important. The reason being, floss is the only way to clean between the teeth where the teeth touch. We cannot do it with brushing alone, and we cannot do it with just rinse alone. It's one of my attendings back in residency used to always use this analogy of cleaning your bathtub. You can squirt a whole lot of Clorox on your bathtub, but it really won't get clean unless you scrub it with a little paper towel or something. You need to use that mechanical debridement to really clean out plaque from between the teeth. So this is huge. I like to say do this before bed. I like to use string floss, but there's a lot of different kinds of floss out there, floss picks that are on long handles. So whatever works, whatever you use is what's best, whatever gets you to use it. If we're using string floss, we want to try to make that letter C shape around each tooth and slip under that gum pocket one more time to get the plaque from out in that pocket and pull down. Ooh. Yes?
So what about the water flosser? Would you recommend that?
You know, I do like the water flosser, and look at that, it's right on my slide. It's a nice adjunct, and you know, for patients that aren't able to do string floss or floss picks, you know, you're just not really into the string, I like the water flosser. Is it as good as string floss? No, but it's better than not doing any type of floss. Yeah. So a little bit about these adjuncts. So here's one on a little stick, which is super helpful for reaching in the back, especially for patients with arthritis who really can't deal with the string floss because it can be sometimes hard to get all the way back there. And the water flosser is really nice for underneath bridges, places that you can't get. Underneath bridges and braces, we sometimes use these floss threaders. We can string our floss through this eye of the needle here. This is made out of a soft plastic, so we can just poke this through the teeth and get our floss underneath braces. Additionally, we've got these little Christmas tree toothbrushes that can sneak between spaces in the gums and underneath braces and bridges. So finding what works for you, a challenge to try a new product this month and see if you like it. Just do a little at-home research. Additionally, mouthwash is a nice adjunct. It's kind of like squirting the Clorox in the bathtub, so we don't want to just use mouthwash after brushing, but it can really be a nice adjunct and people love it. There's so many types of mouthwashes out there, and some of them are tailored for different needs. So they have a anti-sensitivity mouthwash, they've got periodontitis oriented mouthwashes, and some of them are more natural. This is a really nice one, Stella Life. And some extra fluoride mouthwashes. So using what you think you need based on what your dentist might recommend. And similarly, toothpastes can be suited to your needs. So fluoride toothpaste help to prevent cavities and fortify our tooth structures. But there's also toothpastes that are formulated specifically to fight the bad bacteria that are found in gum disease. There's some gum disease-oriented toothpastes. Toothpaste for sensitivity like Sensodyne, and toothpaste for whitening. But I just want to point out that some toothpaste for whitening do have abrasive materials within them. So I like to tell patients to avoid toothpastes with silica in them because sometimes you'll see a little bit more wear. So you're looking for whitening, but you're traumatizing the tooth structures a little bit. At what cost? All right, so habits that can negatively affect oral health. Conversely, our poor oral hygiene, infrequently going to the dentist, mouth breathing as well, and that has to do with that dry mouth thing that we talked about earlier. The less saliva that's in our mouth, the more irritated the gums and the teeth will be, and we get less of that protective effect from the saliva. Smoking for that same reason. Alcohol, which is associated with oral cancer, and you can find mouthwashes that are alcohol-free for this reason, and that's helpful. And a diet that's high in sugars and carbohydrates. Ideally, we'd like to have a diet that's full of whole foods, balanced diet, lots of fruits and vegetables and water rather than juices and sodas and sweetened coffees. If we do have carbohydrates, we have a piece of candy, whatever, Halloween's coming up, we want to wait about 30 minutes before we brush our teeth to allow that acid to kind of die down before we go in with our toothbrush and clean everything up. And following up very carbohydrate heavy foods with fruits and vegetables and water is nice too, to kind of wash it away. And carbohydrates are not only found in sugary foods, obviously. We know that carbs are found in bread and crackers, and sometimes it can be deceiving. Like a snack like crackers or goldfish can really stick to your teeth with those carbohydrates and be just as dangerous as candy can be. So really keeping our mouth clean after we have those yummy snacks. So what your dentist can do for you to help you achieve oral health, not all on you, is doing our dental cleanings. We can really achieve a lot more cleaning and in harder to reach spaces and deeper in the gums with the instruments and power washers that we have at the office. And we like to give you guys cleanings every 4 to 6 months, and this will vary based on your specific needs. If we see signs of gum disease, we might want to see you more frequently. And this helps to maintain the health of the gums where it's at. Even if there is gum disease, we want to maintain the levels of bone and gum that we have, creating a stable environment, removing plaque and tartar that you cannot remove at home. And additionally, we want to do some dental exams 1 or 2 times a year, which might include x-rays as prescribed by your dentist. And these exams help us to note things when they are starting early. A tiny cavity that's still within the enamel or just at the gingivitis stage, when we can give you some advice or do a quick filling before it becomes a tooth infection, or you need a crown, or you've broken the tooth, or etc., lost bone. Yes, I think I've covered everything on that slide. And a lifetime of oral health starts early. Does anyone have any kids or grandkids? Yeah. Do they brush their teeth? They like it?
When I know my son, he's talking about his daughter, and he says he doesn't like it.
Well, of course, yeah. We've got to train them early. So parents should start, okay. Well, I'll get into that. Because baby teeth are important too. So even though baby teeth are lost eventually and replaced by our permanent teeth, infections and cavities that are present on baby teeth can have a permanent effect on the adult teeth. The adult teeth lie right below the baby teeth within the bone. So infections that are present on baby teeth can damage the adult teeth. Additionally, pediatric patients, children can have severe toothaches and cavities and pain. They can even have facial swelling from infections just like adults can, which can be dangerous. But even, more simply with just a toothache or a cavity pain, hurting when they drink cold water, it's not a positive experience for kids to have. And treating small cavities or doing cleanings at the dental office is a much more positive experience for them, which shapes a positive attitude toward the dentist for the rest of their life. I've heard so many times from my patients, I hate coming to the dentist, and it all started because I was a kid and I had this bad experience, and it really does shape you. We like to, start them off on a great routine, a nice habit, and make their experience toward oral health and toward the dentist very positive, which sets them up for a lifetime of oral health. So some signs that there might be a dental issue among pediatric patients. With cavities, we might see dark coloring on the teeth. We might see a hole in back teeth or front teeth. Pain when eating, drinking sugary or cold food or drinks, or just out of the blue. Avoiding certain foods. Infections might present as bumps or pimples on the gums or even swelling on the face. And a lot of injuries to teeth happen with the little ones. They're very busy and they're gaining their footing. So when that happens, we definitely want to see a dentist when a tooth has become chipped or loose, just to make sure that there's no damage to the adult teeth. So we'd like to establish those good habits early and establish their good attitude toward the dentist and oral health early. We like to see kids before they turn 1 in the dental office, and we don't do very much that time. We kind of just introduce them to the dental environment, make sure that they see that it's very happy, it's fun, there's a prize at the end, and they get to have their teeth counted and brushed, and check in with mom and dad about what the habits are like at home and what they can expect in the next few years, what teeth might be coming out, and give some advice. So with infants, we like to wipe their gums at home with a wet cloth after milk, and we like to keep it to water at night as infants get a little older. Once the baby teeth come out, parents should brush teeth with a pediatric-sized toothbrush and some pediatric toothpaste, just a right-size amount, and supervising the kids because they don't like it. It's a completely new thing. It's just like how kids don't like going to school and sitting at their desk. We just need to introduce them to these little habits that will maintain for the rest of their life. And brushing should be supervised until they are old enough to tie their own shoes is generally really the guideline. That's usually age 7 or 8 until you can really be sure that they're getting all those sides of the teeth. They're not just brushing the front, they're spitting out the toothpaste after they're done. And importantly, after that nighttime toothbrushing, having kids drink nothing but water. We don't want to have milk or sugary drinks in bed at night because that's a big risk factor for severe decay. We want those carbs sitting on the teeth overnight. And that's about it. I would love to take any questions. Yeah.
I am genetic predisposition because my mother and my father, they had no teeth. You know, they had complete full dentures. And I know when I was working, and I used to go to the dentist, he would always say, I gotta brush your times, I gotta floss. And when I'm working, I just couldn't spend that much time. Especially in the middle of the day, I didn't have that much time to brush, and it was always bleeding. And so, can you explain it to me so I can understand what's happening? Why is there bleeding?
Yeah, why is there bleeding? Let me go back to my little cartoon here. So we talked a little bit about bad bacteria in the mouth and the immune system fighting it off. So we usually think about gum disease like a little seesaw, where there's gum disease on the one side and oral health on the other side. And there's a lot of stuff that's sitting on the two sides of the seesaw. So some might be genetic factors, like your parents had gum disease themselves and it's leading it a little bit more toward gum disease. Other things are bad bacteria, also leading it toward gum disease. And additionally, your body's reaction to that fight between the bacteria and the immune system. Because what actually causes the damage to the gums and the bone is the release of fighting factors from your immune system trying to tame that bacteria in your mouth. And some people may have tons of bad bacteria in their mouth and they don't get any signs of gum disease. Other people might not have that much bad bacteria compared to good bacteria in their biome, but they have big signs of gum disease and a lot of bone loss. So it has a lot to do with how your body reacts to it. So that's kind of where those individual factors come in. It's not just about brushing, that you're not doing enough, although that really helps. The reason that gums will bleed, so when we get that increased immune system reaction, it happens the same thing when you cut your arm. So you cut your arm and there's an injury and there's some signals that are released by the cells here to the rest of the body that there's been an injury. So the peripheral arteries and vessels will start to dilate and you'll start to bleed. And this helps because it brings out the immune systems from other parts, the immune cells from other parts of the body who have come to fight. So this happens in your gums. If there's excess irritation, there's too much bacteria, the gums will puff up. You'll get more blood vessel dilation there because there's more immune cells coming in. And once the immune cells start coming in, they start releasing all these factors. They're shooting off all their guns at the bacteria. And this will make the gum tissue more fragile just because of what's going on. It's like a battlefield. So a lot of times in advanced gum disease, you'll see bleeding from very minute things, from just brushing or just eating or whatever, because it's just very fragile tissue because of what's going on, what it's dealing with.
No, I don't have that because now that I'm retired, I feel like I have all kinds of brush. Every time I eat, I brush.
Yeah.
But I don't snack because I'm not. If I spend that much time, to do all that cleaning, I brush, I do the water flosser, I do the other one, the wax part. I just don't, I'm not going to eat. So I don't snack after.
Yeah, the toothbrush is like a ball and chain now.
The three brushes, once in a while I go forward because if I stay up late and I'm watching something, then I need a minute. Oh, God, but I have to stay on top of it, and I know it's because of my position. Because my husband, who only flosses when the day before he goes to the dentist,
Yeah, so great job.
Great
And
job.
that's exactly what I'm talking about. Some people won't get a cleaning.
And I don't get that.
Yeah, yeah. Well, it's all individual. But keep it up. It sounds like you're doing a great job.
At least now I'm on top of it, but it's a lot of work.
It is.
It's a lot of work. Because I know if I stop, it's gonna start bleeding.
It's a lifelong habit.
So, my teeth, since younger, I used to go with the school to the dentist, they used to just pull all the teeth. So it was a lot of bone loss. And then I'm learning that even to get implants or things like that, it would be a lot of work, a lot. So I'm thinking, I'm trying to keep up with the teeth health. And it's like you can't catch up. It's like you do one and something else. So I'm like, I don't know how financially and also with one going good, one going bad. And so I was like, I'm just going to pull out. Pull down and get a denture. But I don't know how realistic and how does that, I mean, I don't know what that compares to. Like I'm saying, I'm getting older. So I'm like, okay, so there's only a certain amount of finances that I have, a certain amount of time and bone. So I'm like, oh, is that, I was thinking to go to have a consult, but I mean, that's like I have teeth. I would like to keep them, but it costs a lot of money to maintain them.
It's true, and sometimes when the decay risk or the gum disease risk is so great, we kind of have to make the decision with our patients, like what are your goals? And sometimes the right call is to abandon the teeth and start from a fresh slate. And I mean, nowadays it's great because we don't have to choose between do I try to chase after my natural teeth or get removable dentures. A lot of people are happy with removable dentures and they can be very comfortable, but some people can't tolerate them. So we've got a whole arsenal of getting people new teeth that stay in with dental implants. There can be a cost, a high cost associated with it, but it's always possible to get the care that you need. Particularly, I mean, at my office and between my office and that clinic with the dental residents, it's definitely possible to get the care that you need. So it's always worth it to go for a consult. I'd love to see you.
Teeth are so important, and thank you for educating because, that now education is paramount. They don't educate people.
Yes, and I feel like all of society, we kind of think about our teeth as like this discrete entity, like, oh, well, my tooth's chipped or whatever. But it really is all related. It's all part of your body. And we wouldn't walk around with a cut on our foot for like 2 months, So it's an interesting way to think of it. Teeth do so much.
I was going to a dentist. I was like, I'm going to do this, and I'm getting crowns, and then they're talking, like even the dentist, they're talking about how their weekend was. I'm like, educate me as the time I'm sitting in the chair. Because, things that the dentist may know that a person may not know that time is crucial.
It's easy to take for granted all the knowledge that we have, right? Yeah, it's true. Yeah, of course. Yeah. Say again, who is not? There are very few complete contraindications where we say you absolutely cannot have dental implants. I mean, patients who are in very poor health, like they're getting dialysis, or, things like that, sometimes we might say it's not really a good time to get elective treatment like dental implants. I'm sorry, I should have put some more tooth replacement slides in here. Anyway, dental implants replace, for those who don't know, dental implants replace missing teeth. When the tooth and the root is lost, we insert dental implants, which are a metal artificial root in the area of the previous root, and then we attach a crown, similar to how we put a crown on top of a natural tooth. So the way that dental implants get their support is through the bone, just like with the teeth. There needs to be enough bone in the jaw for the dental implant artificial root to be inserted. Sometimes if there's not a lot of bone, we might say, it's not really a good spot for a dental implant, you're not really a candidate here. But there are really always ways around it because we have advanced bone grafting techniques today. We can do things like place implants in a spot next to it that has more bone and attach a bridge, things like that. So it's hard to say. There's not a lot of times that you're completely not a candidate. When dental implants aren't an option, there's always removable bridges. We can always get something to replace a missing tooth.
With dental implants, can you still end up with gingivitis?
You can, yeah. It's nice about dental implants that you can't get decay because you don't have that mineral tooth structure anymore. You've got metal and ceramic and crown. So you cannot get decay, but you can get issues with the gums and the bone surrounding the dental implants. And gum disease is really like the big risk factor against implants. That's really the time that we say that a dental implant has failed. If we end up getting a lot of bone loss around the implant, we might have to remove it. So after dental implants, patients still need to get their teeth cleaned, their gums cleaned around the implants to maintain them.
So the oral care is the same with the flossing and all that?
Yeah.
Are they able to floss
Yeah.
and have that?
Yeah, able to floss, able to treat it like your own tooth. I mean, it depends on what you've got on the implant, whether that's a denture that clips in or a fixed bridge or just a single tooth. But you can use all those adjuncts, and your dentist can tell you too for specifically what you have, what they recommend.
Sometimes when I run out of mouthwash, I went to hydrogen peroxide on board. Can you use that? Am I doing anything bad to my gums if I use?
You can use it, but it's a little harsh. You know, if you run out of mouthwash, I'd rather you just, wait a couple days until you get some more. It's a little harsh. Mm-hmm.
I think I had a sense that tried using like the whitening strips or like the cups with the whitening solution.
Yeah.
Sorry, totally away from that word. With the solution, and it just made my teeth like super sensitive. And I was wondering if there's like a whitening process that more people are sensitive to.
That is less sensitive. Yes. So most whitening systems use either hydrogen peroxide or carbamide peroxide. And these whiten the teeth by releasing different reactive oxygen species. And this sometimes can activate the nerve fibers at the end of the tooth because it's just a little harsh. This is usually transient. And some products are less sensitivity inducing compared to others. We do a system in our office that's in office only, or you can buy it from your dentist if you want to do at home with trays, and it's particularly to reduce the amount of sensitivity you'll get with whitening. You'll always get a little sensitivity when you whiten your teeth, however. And it's usually transient. You can use something like a Sensodyne toothpaste to deal with it in those few days, avoiding harsh foods.
So if you continually use the Sensodyne, will you get a little bit of sensitivity?
Yeah, it's the way that it works is to block. So, okay, so the structures in our teeth were made up of minerals. It's almost like our bone, and you can see how the bone has little tubules or holes and channels here that blood vessels and nerves can travel through. And if we zoomed way into the teeth, that mineral structure has the same thing. We have some tubules within our tooth structure that allows for tiny little nerves to transverse and also water and nutrients to go in and out. So that's what sensitivity comes from. The way that Sensodyne and other like in-office sensitivity treatments works is by blocking those tubules off with some material so that you don't get that influx of water and things that hurt. So overall, using that Sensodyne over time should help. That's the way it works. And we do like a stronger treatment in the office sometimes for like a specific tooth if it's really bothering you. Mm-hmm.
As you know, Medicare is not covered that. Or vision like that. What's like the average cost of an implant?
I'd say a single implant, like start to finish, is $4,000 to $5,000.
Is
It's, yeah, and it goes to show.
$1,000 in a year, like what are you gonna do with that
I know.
when, you know, more than.
I know it's very minimal. The insurance companies really don't cover a lot of dental for some reason. And it really goes to show how many uses our teeth do for us. It's not only chewing, it helps us to eat healthier, but to talk, to smile, you know, to speak. So, you know, it's really so important. And I mean, I don't know, I can't speak to the insurance companies, but, you know, I mean, a single dental implant is on the costlier side, but you know, if you are in need of more affordable care, there is the clinic on South End Front Street. It might be helpful. I can give you the address. What is the address? The downside with that is that it's very popular clinic, so there's longer wait times. But yeah, it's really top tier treatment and great student doctors there. The address is 197 South Van Brunt Street, stone's throw away, here in Englewood.
So although the dental insurance is up there, can you say anything what
That's good. You know, no, I'm not really that familiar. You know, I've seen some really great ones come out of like employee coverage. Some companies will be very generous with the insurance coverage. Those are some of the best ones that I've seen. But no, I can't advocate for any insurance company. I don't know if I'm allowed anyway. I don't know. There's just so many different kinds of plans. You can eat nuts, and you should really be able to eat most things. The hardest thing to eat with removable dentures is things that you have to bite into, say like corn on the cob or a baguette sandwich or something like that. The reason being they're not fixed, so they might move around. There is, you know, in the past maybe 10 years, we've really moved from making like traditional removable dentures for the top and bottom to adding in just a couple dental implants on the bottom, because the bottom dentures are really what move around the most. We have our tongue and the floor of the mouth, and speaking, it moves around. So sometimes we can combine dental implants, that artificial root, with a removable denture, incorporating some snaps so that the dentures stay more still. And with those, you can eat some more. A lot of people function great. I have some patients, they say, eat corn on the cob all the time. Yes, yeah. So it's a lot of your personal experience with it. You did? Oh my gosh. Well, no one eats that.
You know, it was, I had to go and get it, and it's possible.
Yeah. You cursed that corn on the cob afterward.
So now I take the corn off.
Yes. I do the same. It gets in your teeth anyway, then you eat it off the cob. What's the point? Cut it off is better.
I found on Amazon because I had an idea when they said flossing, you know? So I said, oh, in the shower, that would be good. Oh, I can make this thing and you do it. They had one. I Googled it. I found one.
Nice.
But it was
In the shower?
It's like just a tube you attach to like a diverter, and it's like a tube, and you can attach it just as,
Floss?
I don't use it all the time. I have another flosser, but it's there, you know, just so you.
And it's a nice reminder too. It can just be part of your little routine every day. A lot of people like to use that water flosser in the shower too, because the water gets everywhere with that water flosser. It's like your whole bathroom's wet.
Yeah, my gums are super sensitive. If I eat, I have to stop eating immediately.
Really?
It's like I have a rock.
You feel like you're getting food stuck between your teeth every time you eat.
I have to stop immediately.
That might mean that you don't have enough, your teeth aren't touching each other hard enough. You're getting food stuck. So you might need some crowns or fillings to close those spaces. Because our teeth touch each other to keep some of that food out so the food doesn't get stuffed in between the two teeth, because that can really be painful with that. But that's why you feel like, I got to get this stuff out. You walk around with floss. You're everybody's favorite friend to have in an emergency. You've got it with you. Any final questions? I so appreciate everyone coming and listening. I hope this was helpful.